Now we're going to talk about the pathology of the skin. We'll talk about cuts, burns, and then skin cancer. This portion of the PowerPoint as well as the chapter you will read on your own. I will have a question or two about skin cancers. Won't be worth, a huge, I'm not expecting you to memorize all of it, but as long as you've read through the skin cancer portion of the chapter and the PowerPoints, you should be able to answer the question that I'm going to have on the test. So wounds or cuts, if it's a shallow cut, like a very shallow paper cut that doesn't go any deeper than the epidermis, well, remember stratum basale layer constantly undergoing mitosis, and it can, just fill in that gap where that superficial paper cut was. So if it's a very shallow cut only affecting the epidermis, then those epidermal cells will just be stimulated, especially those stratum basale cells will be stimulated to undergo mitosis and then rapidly fill in that gap. Now, if it's a deeper cut reaching the dermis or the subcutaneous layer, there's a good chance that that cut will lacerate or sever blood vessels, causing blood vessels to break and release blood. So let's talk about how would that type of deep cut heal. Now, I'm not going to expect you to regurgitate the entire wound healing process that I'm about to quickly go over, but these are all structures and cell types that we've already talked about in chapter 4 with the tissues, both epithelial and connective tissues, or that we've mentioned in the integumentary chapter already. So this is how you can apply what you've learned about normal anatomical structures and functions and apply that to a disease state or a pathological state or some type of wound, okay? So understanding the parts and what their function is, if I were to ask you about a disease-like state, you should be able to apply what you know about normal functioning cell types and structures and apply that to how they would act in a not normal or a pathological state. So here we have a wound, a cut that goes deep within the dermis, so blood vessels get severed. What's going to happen is blood will fill this area. We've all had some sort of cut that has caused us to bleed. And then what initially happens is, if you remember talking about blood, one of the components of blood are platelets, and platelets are involved in forming a blood clot. So a blood clot forms on the surface. This helps seal this gap, this cut, so that we don't continuously lose blood. So a blood clot forms. And immediately our epidermal cells, especially that stratum basale, from all edges surrounding this cut, will start to rapidly divide and start to fill in to form a new epidermis over this layer that has been cut. So the epidermal cells will be stimulated to fill in this gap. Remember fibroblast, or if we talk about what's a cell type that's found around blood vessels in connective tissue, we find mast cells that surround blood vessels. Those mast cells secrete histamine. Histamine causes vasodilation, which causes more blood to enter into this area, right? If your blood vessels increase in diameter, more blood's going to fill this area. But we have a blood clot that inhibits that blood from being lost, but more blood is going to fill in this area. Why would we want more blood to come to this cut? Well, blood brings nutrients for tissue repair. Blood brings more white blood cells that can help phagocytize, like these macrophages can phagocytize any bacteria that might have got into this cut. They can phagocytize any damaged or dead cells as a result of this cut. All right, so remember we talked about a mast cell in connective tissue and where they're located and what their function is. This is how that can be related to a pathological state, right? Again, more blood brings more platelets for a clot. It brings more white blood cells to phagocytize unwanted cells. It brings more nutrients. All right, so again, those epidermal cells will be stimulated to help fill in this gap and form new epidermis where it's been damaged. Fibroblast. Remember, fibroblast is a cell type that we find in connective tissue, especially this dense, irregular connective tissue of the dermis. Fibroblasts will be stimulated. What do? They're going to start producing more and more collagen. That collagen helps seal or bring together this gap. Think of it as like a natural stitching, okay? So collagen helps fill in this gap. More epidermis is formed. All right, and then we talked about those phagocytic macrophages that are brought to the area by the blood, helps remove dead cells, debris. And then over time, as all of this tissue repairs itself in the epidermis and the dermis, then that scab will eventually slough off, all right? Now, if you've ever wondered what a scar is, a scar forms whenever your fibroblasts are more active than they need to be, and so they lay down excess collagen, way more collagen, and it raises the dermis, and you get a raised area called a scar. So a scar is just from overly active fibroblasts. Again, these are all cell types or structures that we've already talked about. I'm just applying it to something that a not normal physiological event. So how would they aid? We talked about how these structures and cell types act in a normal state. Well, what would happen if something not normal happens? How would they act? Burns. So burns are caused by extreme heat, extreme cold, electricity, chemicals, or even radiation. And we classify burns based on the extent of the damage on the surface of the body, as well as the depth of the tissue damage. So if you've ever heard of a first degree or a superficial burn, it's called first degree or superficial because it's primarily the epidermis that is damaged by the burn. You may see erythema. This is redness. This has to do with blood being stimulated to that area. Nope, remind me later. Sorry. Okay, so this is the first degree or superficial burns. Primarily the epidermis is damaged. This is very easy to heal because the epidermal cells, the stratum basale, they are stimulated to undergo mitosis and to replace the damage. So all the epithelial cells that are in the surrounding areas where the burn is not, where we just have normal epidermis, those stratum basale cells will be stimulated to fill in and replace this damaged epidermis. A second degree or a partial thickness burn, this is a burn that affects not only the epidermis in the area of the burn, but part of the dermis as well. And so that's why it's called a partial thickness or a second degree burn. Now this can cause more pain, some blistering, and possible scarring. Blistering because of water accumulation and inflammation in that area. Now a second degree or partial thickness burn, how long it takes to heal will be dependent upon how many accessory structures are left undamaged in that area. So if you remember, we talked about the glands, so sebaceous glands, eccrine sweat glands, apocrine sweat glands, hair follicles. Those are all epidermal in origin, and they're all very metabolically active, and they're constantly undergoing mitosis to produce more cells. So if the area that's affected by a second degree burn has abundant accessory structures that are still intact. So hair follicles portions of hair follicles that are still intact, portions of sweat glands that are still intact. Those all contain stem cells that are actively undergoing mitosis, and they can cause this second degree burn or partial thickness burn. They can cause it to heal faster because more stem cells are present to help replace the tissue. All right. Now, if it's in an area or if it affects more of those accessory structures and you have fewer stem cells present to aid in repair, then it can take longer. And that's when we get to a 3rd degree burn or a full thickness burn. You can see the epidermis, the dermis, as well as the hypodermis are all affected. So that means, blood vessels are really damaged, accessory structures with all those stem cells like hair follicles, glands, those are all affected and wiped out. And so there are fewer mitotically active cell types that can aid in repair. So a 3rd degree or a full thickness burn would take a lot longer to heal. Okay. Let's see. Oh, so not generally as painful. And the reason for this is not because it's not bad. It's really bad, but it's not generally painful at first. And that's because the full thickness burn has wiped out all the nervous tissue structures in this area as well. So the nerves, those sensory nerves, are far too damaged and destroyed they can't send that information to our brain to make us aware of the pain. I'm not going to ask this on the test, but if you are in healthcare or if you want to, this is how we apply burns in a clinical setting. There's a rule of 9s. And so they'll assess the human body and how much of the body is covered by burns. They use these percentages. And so if you hear, the front of the anterior side of one leg, it constitutes 9%. This anterior portion of the leg, right, is 9%. The posterior, 9%, 9%, and so on. So this is just a way to communicate the extent of burn damage on a human. And then again, the skin cancer portion, read through this on your own. You do not need to memorize all of it. If you read through the skin cancer PowerPoint slides and the small section in the book, you should be able to answer the 1 or 2 questions that I may have on the exam. So lifespan changes. So cell cycle, what happens to the integumentary system over time as we age? Well, cells become less mitotically active, so the cell cycle slows. And that means that our skin cells become more scaly because they just enlarge over time. We're not really getting new cells. Well, the fact that our cell cycle slows and these cells aren't synthesizing new cells as quickly, our epidermis and our dermis become a lot thinner. This is why elderly individuals they get bruises more easily. They also, their skin is just way more sensitive. It's because their epidermis gets much, much thinner, as well as their dermis becomes thinner over time. Loss of fat in the subcutaneous layer. This is why elderly individuals have a hard time regulating body temperature, and they might feel cold a lot more. Wrinkling and sagging of the skin. This has to do with the breakdown of collagen. And then the fact that cell cycle slows, those fibroblasts aren't producing collagen as quickly, and fibroblasts aren't producing more of themselves. And so the collagen that they do have in their dermis starts to break down, and we get wrinkling and sagging of the skin. Sebaceous glands secrete less oil. That's why elderly individuals might be more prone to dry skin, and therefore friction, the skin might break open more easily, and they're more prone to infections. Melanin production slows over time. That's why elderly individuals, their hair whitens, but also their skin is less adept to dealing with UV damage. Hair thins, that's because, again, cell cycle slows, so those keratinocytes aren't undergoing mitosis as readily, so hair we stop producing as much hair. Nail growth, all of these, you can go through these last couple. This all has to do with the fact that the cells over time are less metabolically active. They undergo mitosis less, and so all of the normal functions start to decrease over time. Keratinocytes, they're less metabolically active, so they produce less vitamin D. That's why elderly individuals might have trouble with calcium absorption, and therefore it affects bone density a lot of times. Okay, and that is the integumentary system.